Hello, I'm Dr. Brandt Gibson, and today we're going to talk to you about being pigeon-toed. When we evaluate the way somebody is walking, like we talked about a couple days ago, we look at to see if they walk rectus or straight, if they are abducted or they're turned out like that, or if they're adducted or pigeon-toed. Pigeon-toed used to be very aggressively treated in kids because it doesn't look good, and it looks actually pretty bad when they're walking. There are certain types of walking patterns that this is quite common and quite normal, and by putting a simple orthotic or insert in their shoes, it straightens them out to more rectus position. There are other situations where it's an anatomic problem. Typically, when a child is born, their feet are turned out, and then as they develop, they'll turn all the way in, then they turn back out, and they turn straight, which is a process they go through from birth to about 2 years old. And so the change is quite common. At one point, they used to put shoes that had a bar between them for this. They found they don't need to do that anymore. A lot of times it could be treated more simply, either by stretching out the muscles or doing some of the stretching as they're getting their diapers changed, or whether it's doing normal type progression in how they're walking, so forth. There also are inserts you can put in. One of the common ways that we will actually treat a severe pigeon-toed, especially after a certain age, is called a gait plate, which is an orthotic you put in there that when they stand like this, it's uncomfortable, and so they'll use the muscles, and over time they'll teach themselves to be straighter. This is the common thinking of an individual saying, okay, I'm going to put them in ballet because they're pigeon-toed, and it actually can fix the problem. Gait plate does a similar type thing. The idea is even being pigeon-toed is not necessarily a problem other than the appearance, unless you start having other symptoms, other things going on. If they're tripping all the time, that's a problem. If they are complaining and don't want to walk, that's a problem, especially if you have a toddler that wants to always be picked up, that they walk for a little while and they always want to be picked up, because usually as toddler will get more active, they would rather be down and moving, and if they're having leg or foot pain, that will limit them from doing it. Or if they don't go play with the other kids, that's also an indication sometimes that they have foot or leg pain. And in that case, if they're pigeon-toed, it is worth being treated. It is worth doing something in their shoes. Like I said, you can do a gait plate, you can do a simple orthotic based on the way they walk that will actually change the way they walk. Sometimes even a good shoe will actually do that. That being said, it is important that you get evaluated if they are pigeon-toed to decide if something does need to be done, because you can prevent problems down the road if they're treated at an earlier age, especially in kids, because what's happening as they're growing, the tendons and ligaments and even the bones to some extent are changing and developing based on the position they are in. And so if you put them in a more natural position, the body will get so that that's more normal. So when as a kid, they may be like that, but after wearing orthotics for a while, they get the point. So even when they're barefoot, they're more straight just because the tendons and ligaments have adjusted to the new position. So this is Dr. Brandt Gibson, and this is your Podiatry Tips Day 31. And we talked about being pigeon-toed.